Hafaday Guam. We're recording from our remote location for our office out here in Washington, D.C. And it's about 10 o'clock at night with the latest updates on where we are with the federal relief package that's working its way through the Congress. Basically what's happened is the Senate first introduced their version, the CARES Act, which got some resistance and it didn't pass on 2 occasions. The House introduced its version so that we can see where everyone stands on the issues and everyone can come together and negotiate a final outcome. And we've, I think, come to a final outcome. And I wanted to be able to share with you what that final outcome looks like so that we can all have an idea of what to expect and what work needs to be done in order for the people of Guam to be able to finally get the relief that all of you are so waiting for. First of all, I hope that you're okay, your families are okay, and everybody is staying safe. These are tough times. We're doing everything we can out here to try and make them not as hard and not as scary. And right now, aside from this, the scare with respect to our health, we also have the scare with respect to how we're going to make ends meet, provide for our families, keep the lights on, stay in our homes. And that's pretty much what we're addressing here in this whole process out here in the Congress. This is not just something, of course, that Guam is facing. This is being faced all over the country. Our focus, the focus of your congressional office, was to make sure that Guam was included in every single component. In the past, back in 2008, during the financial crisis, when everything collapsed economically, the territories were left out in so many ways. In 2001, during the 9/11 unfortunate event, that also saw territories get left out in some respect. What I'm very, very happy to say is, as of right now, the territories have been fully included in every single component of relief that's coming to every other American throughout the country. And that's the one thing that we made sure to fight for. There's so many different things that we can go out there and try and push for, but we said, you know what, we're just going to do everything we can to make sure we get treated the same way as every other American. And as of right now, that's looking like what we're going to be dealing with in these circumstances. And so I wanted to share with you what they are. When the Senate first put out its direct cash assistance proposal, it was talking about doing somewhere around $1,000 per individual. We came back out on the financial services side and we said we want to go to $2,000. They eventually met in the middle somewhat, and it comes out to $1,200 per individual. That will be applied if you make $75,000 or less, and it will gradually phase out into the $90,000 salary range. If you're a couple, of course, you qualify for that twice as a dual filer. And so, of course, the maximum will be $150,000 per couple, pushing up to just under $200,000 if the salaries are that high. It gradually phases out as it gets above $75,000. On top of that, you're going to get $500 per child. And so for a typical household, you're looking at $2,400 for mom and dad, and you're looking at, if you have 3 kids, another $1,500. And so that comes out to a total of $3,900. That's going to be paid one time, just for a one-time payout. I know that everyone's concerned about what happens next after that. We have some other items that we're going to be sharing with you that's going to cover some of that. But I also want to let you know that everyone's already talking about phase 4. This is phase 3. Everyone's already talking about phase 4. So this is not the end. This is, I really think, just the beginning of how the federal government is going to be responding to the needs of our families and getting the help that we need. So people are wondering who's going to get this money. The way it's worked out so far is if you paid taxes in 2018 or 2019 and you're on the tax rolls, your name is included, and you also have to have a social security number. If you have an SS number and you're on the tax rolls for either 2018 or 2019, then that money will be coming your way. There's some question about how that money is going to be coming our way. And that's where it got really complicated because the territories have different mechanisms than the states. And that was one of the things that we were really concerned about because we were worried that those complications are going to make the Congress just say, you know, never mind the territories, we're just going to take care of everybody else because it's too complicated. So we're very, very happy that our leadership in the House and our counterparts in the Senate were able to keep us included and work around those complications. What's going to have to happen is, in the rest of the country, it's going to be paid through the IRS. The IRS is going to be handling those payouts and mailing the checks directly to the taxpayers, or direct depositing it, because a lot of the taxpayers in the States already have that set up, but we don't have that set up on Guam. What's going to happen is, because the Guam tax system is outside of the IRS, the government of Guam is going to have to reconcile the tax filers with the U.S. Treasury to be able to make sure the payments are going to who the Congress is intending for it to go to, which are those who pay taxes either in 2018 or 2019, and also have a Social Security number. Just to clarify, you don't need to have paid taxes, you just need to have filed. So if you filed in 2018 and you got a big refund, you're going to be getting this cash payout. And so this is a lot of money that we're talking about. If we have 10,000 households that qualify for this, we're looking at $39 million in cash payouts into Guam over the next, coming up for the next month. If we're looking at 20,000 households, Guam is going to get $78 million just to cover that 1 month. And that's going to be going to every single individual that qualifies, making less than $75,000, and also for the kids, however many children that you have on your tax rolls. Next, and this is a really big one, Guam does not have any unemployment insurance program. And that's, for a variety of reasons, the local government never implemented it, but it's turned out to be a very big problem, because the federal government not only provides some support for unemployment programs, but because that infrastructure already exists, that was what they were channeling all this unemployment support through. And so I made sure to get on my calls and tell the Congress, and I had to remind them that not every jurisdiction has unemployment insurance already set up. And so the territories, in some previous legislation, there was money that went into unemployment programs that didn't reach the territories because we don't have an unemployment program. And so what they've crafted in this new legislation is a different way of funding unemployment. So they still fund the unemployment programs through the various states, but they created a new type of way so that it's called pandemic unemployment insurance. And so the way this works is it uses the existing infrastructure of unemployment programs throughout the states, but if you don't have an unemployment program, then the government is going to have to work out a program with the Secretary of Labor, and the federal government is going to have to approve the details of that program. And then once it's approved, the money is going to channel through that new mechanism that is set up. And so we've created an opportunity for Guam to be able to access money that normally we would have lost out from because we don't have the existing infrastructure. The catch to that, of course, is the government of Guam is going to have to do its job and be very effective in setting up that agreement with the Labor Secretary so that the people who are unemployed aren't going to have to wait too long. Once this bill is law, that money is available, but the program still needs to be administratively set up by the government of Guam. So at the end of this presentation, we're going to kind of go down the list of what the government of Guam needs to do in order to access what we've made available. So on the unemployment insurance, this is a big deal. Everybody who's unemployed or furloughed will get the average of what every other state gets. This is how they calculated our formula, because we don't have an existing formula. And so the average of what every other state gets comes out to $330 a week. $330 a week going to every single individual who is unemployed or furloughed. On top of that, and this is where the bill came in to put more resources, is an additional $600 a week. And so that comes out to a total of $930 per week for everyone who's unemployed or furloughed. So for a 2-week period, you're looking at $980. So that's a big deal. Let me make sure my math is right on that. 930 times 2. $1,860 for a 2-week period. There are some debates still going on in the Senate. That's why we're kind of up late at night right now, because there are some senators in the Senate who are pushing back on this. They're trying to limit it or cap it where it's going to be the lesser of either $600 plus the $330, either that amount or the lesser of 100% of what you were making before. That's still up in the air. So either way, one of two amounts will be coming your way. Either one, it's going to be what you were making before you were unemployed, or two, it's going to be $930 a week. That's a big deal. For 20,000 workers, we're looking at $18 million a week coming into Guam. And that's just for 1 week. That extra $600 on top of the $330 is good for 4 months. This bill juices that unemployment by $600 for 4 months. And so you're looking at $18 million a week. You're looking at $74 million a month. And you're looking at $297 million for 4 months, just for Guam. If we have a 10,000 workforce that's been displaced, you're looking at $9.3 million a week, $37.2 million a month, and $148.8 million for the 4 months. This is a dramatic amount of money. It's going to put money into the pockets of our unemployed people so they can keep consuming and spending and help the economy to sustain, so that if you're laid off or terminated, it's not going to just completely sink everything. And that's why we were asking businesses to just hold on with your payrolls, because if they can just hold on for this bill to pass and for the government to create the program and implement the program, then everything's going to be able to turn on the unemployment side, and we'll be able to smooth everything out, and there's not going to be a huge shock to the system. So we have the cash assistance, which every taxpayer will get if they qualify. We have the unemployment insurance that will go to everybody who lost their job or is furloughed. You will get both if you qualify for both. So for the next month, you're looking at that $1,200 plus the $1,000, the $930 per week on the unemployment insurance side. Again, though, it depends on how quickly the local government gets the program up and running. Some people worrying about their rents and their mortgages. If you have a federally backed mortgage, a mortgage that was bought by Fannie Mae or Freddie Mac, which is a lot of our mortgages on Guam, you're going to be getting mortgage forbearance, which means for as long as there's a declared state of emergency, a declared federal state of emergency, up to the next 180 days, you don't need to pay your mortgage. The interest will continue to accrue, but that'll be factored into the back end of your mortgage. It won't count against you. And so the legislation mandates that your banks, if you have a federally backed mortgage, they need to give you mortgage forbearance for up to 180 days. And that passes through to renters, because in the legislation, we also suspend evictions. So if you're renting, you will not get evicted for 120 days. That's in the legislation. There's still some math that needs to be worked out in terms of how our landlords who don't have mortgages, going to be compensated for their lost revenue. Again, like I said, this is phase 3. That's going to be a conversation for phase 4. I was in conference calls all day. A lot of these gaps that are being talked about are already going to be in the phase 4 legislation that's going to be created. So we still have a lot of work to do, but just to make sure that everybody who's worried about April 1st, who has a mortgage or who has rent due, rents will be suspended, and you can get mortgage forbearance from your lender if it's a federally backed mortgage. There's additional items for employers. And again, this was why we were saying to hold on to your payrolls as long as possible, because they created certain credits here that we want to make sure that you're aware of. And I'll just go ahead and read off to you what was sent to me in the brief. The provision provides a refundable payroll tax credit for 50% of wages paid by employers to employees during the COVID-19 crisis. The credit is available to employers whose 1. Operations were fully or partially suspended due to COVID-19 related shutdown orders, or 2. Gross receipts declined by more than 50% when compared to the same quarter in the prior year. The credit is based on qualified wages paid to employees. For employers with greater than 100 full-time employees, qualified wages are wages paid to employees when they are not providing services due to the COVID-19 related circumstances described above. For eligible employers with 100 or fewer full-time employees, all employee wages qualify for the credit, whether the employer is open for business or subject to a shutdown order. The credit is provided for the first $10,000 of compensation, including health benefits paid to an eligible employee. That's why we said hold on for 3 weeks, so that generally can cover 3 weeks of payroll for most of the businesses on Guam. The credit is provided for wages paid or incurred from March 13, 2020 through December 31st, 2020. We do have some items here for the hospitals, GMH and GRMC. There's an expansion of the Medicare Hospital Accelerated Payment Program. This section would expand for the duration of the emergency period existing Medicare Accelerated Payment Programs. Hospitals, especially those facilities in rural and frontier areas, need reliable and stable cash flow to maintain an adequate workforce, buy essential supplies, and create additional infrastructure to keep their doors open to care for patients. Qualified facilities will be able to request up to a 6-month advanced lump sum or periodic payment. This advanced payment would be based on net reimbursement represented by unbilled discharges or unpaid bills. Most hospital types could elect to receive up to 100% of the prior period payments, with critical access hospitals able to receive up to 125%. Finally, a qualifying hospital would not be required to start paying down the loan for 4 months and would also have at least 12 months to complete repayment without a requirement to pay interest. Basically, you're going to take what you're bringing in previously, fill that gap, not charge you anything for it, and then you can pay it back over time without any interest. And so that will help the hospitals to be able to meet their operations. But that's just one component for the hospitals. I'm going to go into some other items here that kind of come together in terms of spending for the treatment of the virus, but also helping the government of Guam to make sure that it's able to meet its operational costs. So the government of Guam is going to be getting several chunks of money and have access to additional chunks of money. The biggest chunk that all the governments are going to be able to tap into is a 100, give me 1 second here. There's a $100 billion, with a B, $100 billion amount that's made available until expended to prevent, prepare for, and respond to coronavirus, for necessary expenses to reimburse through grants or other mechanisms eligible healthcare providers or healthcare related expenses or lost revenues that are attributable to coronavirus, provided that these funds may not be used to reimburse expenses or losses that have been reimbursed from other sources or that other sources are obligated to reimburse. Basically, here's your chunk of money. If you need the money to be able to meet those expenses that you incurred as a result of this crisis or the revenue that you lost, you're going to be able to tap into that money. You just can't double dip into that money. And the double dipping component is important because there's other chunks of money that are being provided to the government. And if the government doesn't move its pieces right on the board, it might use one pot to fill a gap and then all of a sudden disqualify another pot that could have filled that gap. And so the government's going to have to be very, very smart as to how they move their pieces on the board so that they're not putting money into one place and then cutting off an opportunity to put that money someplace else and then reprogram that money someplace else. I know it's a little complicated, but yeah, that's government finance for you. So that 100 billion is available for that purpose. The government is going to be facilitating that. There's also $55 million in additional grants that are being provided to the insular areas such as Guam and the freely associated states. That grant is also available for medical equipment and 1 second. You can tell this is all just coming through to us in real time. Medical equipment and supplies. So medical equipment and supplies that were needed for the COVID-19 treatment. And so you have the 100 billion facility that can be used for that. You have this $55 million facility that can be used for that. And then on top of that, there's $117 million that's going to be made available to the government of Guam that can also be used to meet those public health costs. But that 117 million pot also can be used to offset any losses to its budget as a result of the COVID-19 crisis. So any losses to the budget, unanticipated losses from March 1st, 2020 to December 2020, that $117 million can be used to fill that gap. And so if business privilege taxes aren't coming in high enough, or hotel occupancy taxes aren't coming in high enough, or income taxes or other government revenues aren't coming in, the government is going to have a $117 million backstop. So they have $117 million there. $55 million that's available to the insular areas. $100 billion is available to hospital and healthcare facilities. The government needs to kind of guard that 117 and make sure it very effectively taps those other resources. So those are the resources, max out the spending and the cost on the medical side. And then we can hold that 117 million to protect on the revenue side. Again, the government needs to be very, very smart about how they handle that. And, good luck. I wish them luck on that. And so altogether, on the range here, we're talking about for Guam, just for Guam alone, a minimum of approximately anywhere from $315 million to $503 million, depending on how many eligible households, depending on how effectively the government taps into these resources. But that's the range that we were able to lock in for our island. And that doesn't include any additional amounts that come into a future funding sources in a phase 4 or a phase 5 that we're able to move out. But as of right now, those are very, very big backstops. But again, I'm going to reiterate, we've got the resources, but because the infrastructure that's already out here in the States, unemployment insurance programs, etc., aren't on Guam, the government has a lot of work to do, the local government, to be able to set those things up right away. So that this money is going to be available within the next 48 hours, I think. The government needs to get these programs established ASAP so that money can begin flowing through the system. So first, the government needs to create a list of all 2019 and 2018 filers and their children to put to the Treasury for the cash assistance. Second, the government needs to coordinate with the Federal Department of Labor and the Labor Secretary, enter into an agreement with Government of Guam to create and administer a pandemic unemployment insurance subject to program rules and regulations approved by the feds. 3, the government of Guam needs to account for all of its COVID-19 costs and wisely program that money between the $55 million for insular areas, the $100 billion for hospital assistance, and the $117 million for other government impacts. And it needs to do so mindful of the fact that that $117 million can also be used to offset any budgetary losses. I mean, that's the only pot for that. So that all needs to be coordinated very carefully. But that's pretty much where we are. I'm still waiting for updates as to whether or not that final piece was negotiated, whether they're going to require it to be $600 or 100% of what you made before. That's really, even if it's just 100% of what you were making, at least you know that for the next 4 months, you're going to be covered for whatever your earnings were. And that's really, really good. Hopefully it can be the $600. I'm sure that would be a huge bump. But again, we'll see that that's the last component I think that's being worked out here. But so far so good. I was on conference calls all day. It gets frustrating sometimes because there's hundreds of members of Congress and everybody wants to put in their 2 cents. And so from the beginning I was on hold. I punched in my number, waited my turn, call had to end, next call had to end. Finally we were able to get through on the 3rd call and we were able to say, hey, we're good on the House side. The House has been doing a fantastic job of making sure territories are included. We're just concerned about the Senate side. And so in between waiting for our time on the call, we're also calling offices and speaking to the staff of our various leadership saying, hey, can you guys make sure that all the work that we're doing on the House side is going to carry forward on the Senate side? And the good news is, as of right now, I can say that it has. We've opened so many doors that typically were not available to us. We really got to hand it to our leadership in the House. We got to hand it to our Republican allies on Guam, the Republican Party, they were making calls to their Senate contacts, helping to open those doors. I also need to credit the Guam Chamber of Commerce. They reached out to us, we had our conference calls, and they've been sending letters and emails and making their calls. But this is a Team Guam effort. We were able to open this up and make this possible. Gov Guam just needs to close the loop, but help is on the way. Help is on the way, and it's been a lot of work. We're just very happy that we're able to deliver. Thank you, God bless, and see you tomorrow.